lecture we are going to continue the cystodes, and we are going to study Echinococcus granulosus, the dog tapeworm or hydrated worm. Geographical distribution all over the world, but more common in sheep raising countries as Australia, South Africa, South America, and Mediterranean area, including Palestine. Disease: human Echinococcus hydatidosis or hydatid disease or hydatid cyst disease. Habitat: adult never live in a human intestine but present in intestines of dog, jackal, less common in cat and fox. Morphology: shorter than 1 centimeter long, has 3 proglottids or segments. The first is immature, the second is mature, the last is always gravid and have the length of the whole worm. As you see, scalyx, this is the first segment, immature, mature segment, and this is gravid segment. Rostrum with 2 rows of hooks. The reproductive system is linear, but the lateral branches of uterus are short and non-branching genital in both half of segments. Gravid segment disintegrate in intestine, so only eggs appear in feces. This is the adult Echinococcus granulosus, which is found in dogs and carnivores. As you see, scalyx showing hooks, and this is hydrated broad capsule with protoscalyces. Hydatid cyst larvae. Hydatid cyst is present in tissues of intermediate host of sheep, cattle, horse, pigs, and camels, and even in a human. Larva can affect man, acts as intermediate host. Liver infection 66% of cases, then the lung 10%. Size varies from pin's head to the child head. Content: cystic fluid in which hang the broad capsules, scalyces, and daughter cysts, as you see here. Hydatid cyst consists of: first, outer laminated non-cellular reticular layer, as here. The second is inner germinal enucleated cell layer. From this germinal layer, masses of cells are budded toward the cystic cavity. Some become vacuolated and forming scalyces in their cavities. These are called the broad capsules. The mother cyst may form daughter cyst, as here. These may regenerate granddaughter cyst either into the cavity or outside the capsule. Sometimes calcium precipitate around the cyst. Infection of definitive host dogs occurs when they eat organs from intermediate hosts infected with hydatid cyst. In the small intestine, the scalyx evaginates to give adult worm. This is the hydatid cyst. Pericyst, blood vessels and fibroblasts. This is the ectocyst, a cellular laminated hyaline layer, and this is endocyst as germinal layer. This is broad capsules, and this scalyx, actually, this is stalk, and this is daughter actual cyst, hydatid sand. Life cycle. Infective egg will pass with feces from the definitive host, dogs, to be ingested by intermediate hosts, including man, either with food or water. The egg will hatch in the small intestine to release the endosphere hexaconch embryo that follow the same stages of Taenia larva. The parasite larva will penetrate the small intestine to the portal blood to be filtered there. The rest will be filtered in the lungs, liver, spleen, brain, and heart muscles. As you see here, this is the site of infection of hydatid cyst. Brain, this is lungs, heart, spleen, liver, and bone marrow. As you see here, the adult in the small intestine of dog, then they release embryonated eggs in the feces. Actually, the endosphere hatch penetrate the intestinal wall, and in the intermediate host, they form hydatid cyst in liver, lungs, etc. And the proteus collects from the cyst attached to the intestine of the dogs to form adult Echinococcus granulus. In the man, when the man take embryonated eggs in the feces through the mouth, then the hydatid cyst they formed in the brain, lungs, liver, and in bone marrow. Here, as you see, the hydatid tapeworm egg, Echinococcus species, a general sheet is shed onto the ground in the feces of an infected dog. Tapeworm egg taken by the man or by sheep. A sheep consumes egg when it ingests grass that has been contaminated with the infected dog's feces. The hydatid tapeworm egg hatch in the gut. The hydatid tapeworm larvae that hatch out the egg migrate to the bloody organs, liver, lungs, brain, eye, etc. of the sheep and remains there as a large larva tapeworm cyst called hydatid cyst. Also, as in this is hydatid cyst, and organs can be very large in size, as here in man, where the location they found, as we see or mentioned before, brain, lungs, liver. Here, when dogs may eat cyst if fed offal organs. Also here, dogs allowed to eat carcasses can ingested hydatid cyst mature into adult hydatid tapeworms in the intestines of the host dog need family. Adult hydatid tapeworms shed eggs into the dog feces, as you see. After from 6 to 8 weeks from the time the dog eats the hydatid cyst, the adult tapeworms start shedding eggs into dog feces, where they then contaminate the environment, ready to infect another host with cyst, including man. Signs and symptoms: cystic Echinococcus hydatid disease, human infection with Echinococcus. Granulosus leads to development of one or more hydatid cysts located most often in the liver, lungs, and less frequently in bones. In the bones, kidneys, spleen, muscles, central nervous system, and eyes. A symptomatic incubation period of the disease can last many years until hydatid cysts grow to an extent that triggers clinical signs. However, approximately half of all patients that receive medical treatment for infection do so within a few years of their initial infection with the parasite. Abdominal pain, nausea, and vomiting are commonly seen when hydatid occur in liver. If the lung is affected, clinical signs including chronic cough, chest pain, and shortness of breath. Other signs depend on the location of hydatid cyst and the pressure exerted on the surrounding tissue. Non-specific signs including anorexia, weight loss, and weakness. All these symptoms of Echinococcus or hydatid disease. Diagnosis of hydatid cyst in man. by zone skin test, intradermal reaction, precipitation reaction, complement fixation test. All these depend on antigen antibody reactions. X-ray examination for the classified all test. Prevention: treat infected animals and advise children not to play with dogs or cats. Prevention of infection by adult ones by the execution of the meat of cattle containing larvae to prevent the infection of dogs or cats that eat meat. Elimination of flies and household insects that may contribute to contamination of food and drink. So this lecture covered everything about Echinococcus, granulosus, or dog tapeworm or hydatid cyst disease.